Well, good afternoon, good morning, or good evening, depending on the time you are attending this meeting. Welcome to my talk today, obviously directed to all our colleagues who are part of this network of ambassadors, and to those who are not. Well, welcome so you can join us in this wonderful learning experience. The topic we are going to discuss today is the role of digital photography in patient care and how this impacts the efficiency of all our processes. My name is Jorge Calderon. I am a dentist from the Autonomous University of Manizales in Colombia. I am currently residing in Colombia. My city is called Palmira, Valle del Cauca. I had the opportunity to do my master's in orthodontics in Mexico City. And, well, I am currently part of the OC speaker staff for Latin America for about 10 years. So, it is a great pleasure for me to be with you, sharing a bit of what my learning curve has been with this wonderful work tool that is digital photography. So, without further ado, let's move on. We are going to talk a little about what photography is in general terms. And in general terms, photography means drawing with light. For what we do in our day-to-day, it is very important to be able to record not only the intraoral images of our patient, but also their clinical, aesthetic, and above all, emotional process. Remember that our job is not just to put some teeth in order, but also to transform lives. That's what we do. So, monitoring this, retrieving all this type of information we have to show the patient their process and finally their result has wonderful outcomes for them. Let's see how their self-esteem starts to rise, and we give that push they need towards the new life they've been waiting for during the recent times they've been with us. So, what do we use photography for today? Dental photography is a very useful tool for establishing a diagnosis. So, when we evaluate those photographic records before starting treatment, it will be extremely detailed information. 2. In our mind, draw how the course of that treatment will be projected and what we really want to do. We will be able to evaluate not only the intraoral part, but also something that is very important nowadays, which is the patient's facial characteristics. Not only those we have before starting the treatment, but also the projection we will have at the end of it. Imagine a surgical case. Obviously, we need to know how we are going to project all those soft tissues on that canvas, which is our patient's face. We will also use it to evaluate the progress of the case. Many times we can make segmentation errors with our brackets. And it is right after analyzing those progress photographs that we can make prompt decisions that can be corrected at the next appointment. So, evaluating the progress of the case is also a fundamental tool for our practice. It gives us feedback on how the treatment is progressing. As legal support, well, today we know that photographs become evidence in any legal circumstance in which we might find ourselves involved. So, it will be able to support us and sustain our treatment plan over time, and it will be able to defend us at some point if we face any legal circumstances that are definitely very undesirable. So, what we don't want is that when we are faced with a situation like this, we have to resort to why I didn't take the photographs of the case. As self-criticism, of course, not all cases are the same, definitely, and our learning curve is supported by each of the cases we handle throughout our career. So, the idea is that we don't make the same mistakes we made in one case in future cases, and that we can, with this, become better every day at what we do. A relevant point that I wanted to highlight here is the communication between us and the patient and among us and the parents or guardians of our patient. A patient, sometimes imagines many of the things that might be happening in their mouth, and it is with a well-taken photographic image that we can clarify what is really happening and bring them to the reality they are seeking. And finally, for research purposes, in the event that we are going to publish our case in indexed scientific journals, they require a very high-quality photograph. In the same way, for education, which is what we do as speakers, that's why we emphasize so much on documenting cases very well. So, when you have had the opportunity to see us at conferences, you have even had the chance to critique the type of photography we are using, to educate with transparency, to educate with ethics, and to educate with the reality of things. And last but not least, to be used as a great marketing tool. I use the term ethical marketing because we already know there are some restrictions we have to consider when creating expectations for a patient. The rise of social media. Right now, we are seeing, for example, that in some countries it is not allowed to post before and after photos because we can confuse patients and generate, as critics call it, misleading advertising. So be very careful about what we are publishing. Having the patient's authorization promptly. It becomes critical for the use of their images on social media, in publications, in articles, anywhere that patient's image is going to be exposed. Your personal data, which are really important, and the photographs, not only of your mouth, but also of your face, for greater reason, require your express authorization. So we are talking about a document that in Spanish we call the informed consent for images, and in English we will find as photo release. Here, I want to show you a bit of the form that we as speakers have to fill out before OC with the patient's signature, where it informs them, obviously, where it may be published, that they will definitely not receive any kind of financial compensation, and that they waive, well, obviously, any kind of legal action that may arise when their photographs are used for advertising, educational purposes, or anything else. If you do not have the consent of those patients, you may become involved in a legal process. So, when displaying any patient's photographs, even on social media, you must have this authorization document. So, let's follow the rules, and we will definitely not have any difficulty with this. Well, then, now let's get a bit in tune with the real topic that brings us to this session. We have a big question that we are asking ourselves, and I think we have all gone through. For this type of dualities, do I take my photographs with a professional camera, or do I take my photographs with a cell phone? So, let's clarify this a bit. I will talk to you a little about the advantages and disadvantages of using each of these tools so that we can make the right decision for our dental practice. So, when we talk about a professional camera, we will find them everywhere, like DSL cameras, which is nothing more than the abbreviation for digital single-lens reflex cameras.
no es otra cosa que la abreviatura de Digital Single Lens Reflex Cameras.
So, they are cameras that have many qualities, as we will be able to see shortly. They are cameras that definitely have superior image quality compared to what we can get with a cell phone, regardless of the brand or model. What makes the image quality superior? Well, definitely the size of the sensor. The sensor is this element inside the camera that receives the light, meaning it receives all the information we are asking it to capture when we take a picture. All of this will compose an image. So, by having a larger sensor, we will have more details in the image. In the same way, we know that along with the camera, we have to use, in this case, a particular type of lens. The lenses we use for dental photography are called macro lenses. Why? Because they allow us to magnify all those types of structures that we want to visualize in the photograph. The photographs? Professional cameras have the ability to have manual controls. That is, I can create my own settings. I can adjust the shutter speed. I can adjust the sensitivity. That is, the amount of light I want to enter my image. I can also calibrate the speed at which I am shooting. And it can, in the same way, be adjusted, the diaphragm lenses, to know if I want to open or close them, and with this have greater or lesser depth of field. So, we're seeing a number of terms that may really seem amazing at first, but surely, throughout our talk, they will become completely clear to us. The manual controls will facilitate something that the cell phone does not allow, which is the standardization of the shots. That is to say, I can have those settings, and by adjusting them to the ambient light I have, it will be the same amount of light, image, photograph that I have for all my patients. So I will try to avoid having photographs that vary a lot in tone or composition. Professional cameras require light. Remember, we talked about drawing with light. So for dental photography, we can use two options, twin flash or ring flash. Now, we are going to talk specifically about them. So, to conclude, this type of cameras will generate more detailed images, less light, less distortion, but also will allow this equipment that we buy today to last us a long time. That is, it will not change as much as a cell phone model might. So, ultimately, that is a very big competitive advantage compared to one and the other. Here's what I was telling you about the sensor. A larger sensor, as you can see here, 36 by 24 millimeters from a large camera, will allow us to capture more light, and this will be reflected in greater detail. An image much more full of information for us is relevant. So, sensors are something we have to consider when choosing our camera as well. Disadvantages that I find from my point of view and from my own experience, we have them here. Perhaps the cost is high, but as I was saying earlier, when we make it cost-effective, meaning when the investment in my camera is initially high, but I will have it for a much longer time, it will definitely balance out, despite the initial cost being very expensive. It requires a learning curve, yes. Honestly, I have taken, I don't know, 5 or 6 photography courses, and in each of them, I learned something new. So you always have to keep training and have a learning curve. In basic photography, for example, until we manage to adapt it to what we really want. A third disadvantage is the weight of the camera. So a camera plus a lens becomes a heavy device that, well, you have to know how to carry if this is going to be part of our daily life and we are going to need, well, definitely additional accessories. We will need diffusers. We might need a larger professional light that syncs with the camera, a professional flash, and other aids that obviously make the equipment inventory a bit larger. However, there's no need to fear this. These are investments that easily pay off. If we are going to take photos with the cell phone, we will keep this in mind. Comfort and accessibility, since we will always have it on hand. But having it on hand can also mean that the cell phone gets damaged, falls, its structure is affected over time, and in the same way, it may prevent us from having a complete record of what we are doing. Cell phones generally have an automatic mode. Right now, there are some that allow the latest models, allow us to change the settings. So, playing a bit with some of the variables I mentioned earlier is relevant in dental photography. They allow us to store in the cloud and are evidently less expensive than a professional camera. However, their disadvantages are these: the sensors are much smaller, therefore the information is of lower quality. They automatically process the photo, so it is difficult, unless you have an editing program. For example, if I take my photos on an iPhone, I will have the possibility to edit them in the photo program that, well, obviously, the brand Apple has for these kinds of things, but with some difficulties. I won't be able to manage the lighting in the best way, because it doesn't have. The flash it has is designed to be positioned either very frontally or very laterally, and if we want to take photographs of a full arch, for example, we would need a horizontal shot, so the flash will never fire or illuminate where we really need it to point, which is towards the back of the cavity, but it would result in a very lateral shot. For this reason, it's difficult to standardize my shots on a cell phone. So, let's get into the topic right now because I want to delve into what macro photography is. Well, macro photography has been around for a long time. It has been used previously to document, in this case, photographs of insects in greater detail. It has also been used in floriculture to detail the types of flowers or leaves, that is, more in the biological sciences. So its rise in dentistry is relatively recent. Its application has been increasingly professionalized and segmented to what we want. So in macro photography, we talk about incorporating this element into our practice. A macro lens. There are two types of macro lenses that are the most well known: the 100mm and the 60mm macro. The 100mm macro lens, as you can see, is a bit more robust. It will significantly increase the amount of the image I want to process to obtain, but in the same way, it has a greater weight. This makes it somewhat disadvantageous to use. What does it require? It might require me to move a bit further away from my subject to take a good photo. On the other hand, the 60mm macros are much smaller lenses that allow me to get closer to the patient or the subject, resulting in fantastic images. So if you ask me, my recommendation is that we use a 60mm macro, not only for the convenience, but also for the weight. And it also allows me, as you can see there in the image, to get closer to the object I want to photograph. And as you see here, capture all the details I need, which are really sufficient for what I want in orthodontics. So, we have already seen part of macro photography. Now, we need to understand a bit how the light affects the photo I am going to take. So, in the same way that our pupil automatically controls the amount of light, there won't be, obviously, a camera as perfect as the human eye to do it. That is my great review of this part. So, here, we will have that. One of the important factors in dental photography is being able to control three variables, as we will see shortly. One of them is the aperture, which is what we are going to talk about at this moment. The aperture is determined by a structure inside the camera called the diaphragm. The diaphragm consists of multiple lenses, which are what you see there, that I can adjust according to my need. So as we see, a value, f in this case of aperture of that diaphragm of 2.8, meaning when I have a lower value, I have a larger aperture. It is inversely proportional. So when I have a smaller numerical value, 2.8, I will have the diaphragm almost completely open. What will this allow me? To let in a greater amount of light. The best example of this is the pupils of a cat. When we see them fully dilated at night, it's because it needs to capture a greater amount of light to move easily in the dark. So here, we see how it varies. 2.8, 4, 5, 6, f18, 11, 16, and 22. But we say, well, if I have more light, definitely, how can it affect or not affect the image? And here, we will see it in the example we have at the bottom of your screen. When I use a larger aperture, the depth of field is reduced. It becomes focused. So, as you see here, with 2.8, in the shot I want to take of this entire archway, it only allows me to get information from the two central ones. Look at what happens with 8. Look at what happens with the aperture at 14, at 22, and look at what happens at 32. That is to say, for my photographs, when I want to have depth of field, meaning I want the last parts of the molars to be visible in a photograph, whether occlusal or like the one you are seeing here, what I definitely have to do is close my aperture to 22 or 29. Here, I leave you my suggestion after what I have already done, and that is to have it already set. Your settings, have them set at 22 or 29. That is the golden rule for this. Why? Because I am interested in having depth of field. Remember that. What does this then require me to do? To have a light source that helps me compensate for what's not coming in due to the reduction. So look here, this is a super important tip, and I'm going to give it to you right now. To be able to achieve a greater depth of field, meaning that I can capture, with very good detail, the last molars that are far back. When you are focusing with your camera, you have to place your eye, as shown in this image, between the lateral and the canine. Between the lateral and the canine is where I should focus my camera and then be able to shoot. If what I do is focus only on the central ones, I will reduce the depth of field and I won't have the view I need. The back part will come out blurry. So this is a tip I'm giving you that will be very useful for taking high-quality photographs. I was telling you that the second variable we need to consider is the light. So I have to adjust the ISO factor. You will find it like this when you look at your camera settings. You will find the ISO, and then it says ISO 50, 100, 200, 400, 800. What do I do with this? Where do I set it? Do I change it or not? Well, I'm going to explain what ISO is. It is the sensitivity of the sensor. In other words, I'm also telling the camera, allow the sensor to capture or be more or less sensitive to light. So, for dental photography, what I need is to have it at ISO 100. If I have a higher ISO, the images might end up with something called noise, which is nothing more than a grainy and very dark appearance. So, ISO 100 is perfect, a perfect sensitivity for when I use my artificial light, whether it's a ring flash or a twin flash. The images turn out where I need them to. And this third variable is the exposure time. What is the exposure time? Basically, the time during which, when I shoot, the diaphragm remains open. So here, let's see, it ranges from 1 in 8,000 to 30 seconds at most. 30, which is the highest value. So, what is suggested? That I can be working at, approximately for dental photography, 1 to 160. So I'm gonna open it for 1 second into 160 little parts, and that's what will give me the speed I need. Remember that I have a powerful light source that will help me draw that image in my sensor. So where would I use, for example, an exposure time of 1 in 8,000? I don't know. If we are watching a motorcycle race where they go very fast and I want the motorcyclist's helmet to come out very clear, well, 1 in 8,000 is perfect because the speed is high. So, in the same way that I want to not capture so much speed, but a bit more detail, I can use a lower value. So, my suggestion for you to adjust your settings is at 160. That is the purpose of this. Very well. So, we need to talk right now about light. There are two elements we can use in professional cameras. I have used both. We are going to use something called the twin flash, which is that structure you see there. They are two small flashes that go to the right and left, which need to be synchronized in the same way with the camera to take the photograph I need. Then, in the upper photograph, you will notice how the twin flash works and how the light converges on the target. The type of photography that helps me, the twin flash, is like the one you are seeing in your upper right image, on that little tooth. That one is taken with the twin flash. I really don't like it much for orthodontics. I like it a lot, for example, for dental aesthetics. The twin flash would be more than fine, because it will illuminate the anterior sector a lot. My favorite is the ring flash. And we are going to talk about it. There we have it, the ring flash. It is a synchronized ring of light, but it allows me to have a much more powerful and concentrated light that can reach the back of the oral cavity, which is where I really need to reach. So, if I am in aesthetics, I know I can use it, but if I am in orthodontics, my suggestion is that we use a ring flash. Now, the ring flash, that light, because it is so close to the dental structure I want to photograph, can leave that lighting mark, that reflection you see there. In some cases, it looks unpleasant. In others, some people really like this light glare. I prefer to have a warmer, softer light with less bounce. Therefore, I use this element created by a Venezuelan orthodontist, Dr. David Diaz Cabrera, one of the people I admire most, who works in the field of dental photography, orthodontist. And he has created this, which is called the diffuser ring. He also has the same element for the twin flash, and the light comes out much warmer, much softer, and doesn't have that effect we were just seeing of shine on the enamel structure. So this is my favorite, the diffuser ring. I have been using it wonderfully in my practice for a long time, and with it, what I tell you is this. I can try to reduce that bounce effect in the photographs a little. Here, obviously, there is a raw, unedited photograph. Then I can play with the editing program and correct what I don't like about the image to be able to have. But this helps them a lot. Accessory elements that we must have as orthodontists. Well, the mirrors. There are all kinds of mirrors. There are pediatric ones according to the type of arch, large, small. There are lateral ones, palatal ones. This whole range of mirrors here, obviously, you need to have them as an additional element. Obviously, one starts choosing or selecting some that are considered better, but it's always necessary to have a set of various mirrors to be able, for biosecurity as well, to use them continuously in our practice. A tip I give you is that mirrors need to be humid, and at a warm temperature, higher than room temperature. Why? Or better yet, for what? So that when I put them in my mouth, they don't fog up. They don't get cloudy. That would force me to have an air source nearby to remove that fog. That we call, or that fogging of the mirror. So my suggestion is this. It's a very economical suggestion. It's the one I constantly use here, and it's this type of device that you can easily find on Amazon or in these online stores, and it's a little device used to warm baby wet wipes. So after my son grew up and I wasn't using it anymore, I found a good use for it in the office. So you put all your mirrors there, and the mirrors will be permanent. They are warm all the time and will be slightly humidified. So when we take them out of here, we put them in the mouth and avoid the issue of them fogging up in the patient's mouth. So that's an additional little trick I'm sharing with you today. And the retractors. The retractors will help us separate the lips, either transversely or vertically, to achieve a perfect shot without contamination from other structures. So, varieties of retractors as you see here, as many as you want. So, they come in all colors, and there are even some who want to take their images with a black retractor. And that's not bad either, they are very aesthetic. So, well, there are lateral mouth openers as you see here, for the upper lip, lower lip, adjusted to the size of our patient's arch so it doesn't hurt. Another important tip here is that when we are going to use retractors for dental photography, we should moisturize the patient's lips a little. We will use these flavored petroleum jellies that are available everywhere and apply them to the patient's lips so that when we do the retraction, they do not get injuries on their lips. The patient will thank us. So, here I want to share a bit of what I do in my office when we take photographs. So, to summarize, I told you that I routinely use the Macro 60 to take my intraoral photographs. Some people use a 50mm lens for the extraoral photo set. It is called for portrait photography or portrait frame, so it is very useful for taking facial photographs. I also have it. I like to use it in some way when I do slightly more artistic photography for the patient, which gives me a lot of detail. So, for this photography, which is extraoral, we have to consider several variables. One, we need to have a light source behind the photographer. And we also need to have another light source behind the patient. So I generally have a structure back here with light behind the patient and another light that comes here and counteracts to give me the shot without shadows on the back of the patient's face, because sometimes those shadows in photography with a white background are very uncomfortable, they don't look very good. Important, as you can see there, that I am completely facing my patient. And the tip to get this type of photograph that you are seeing here is the following. So, remember to have a white background that can be a light screen. You can use one of these LED light lamps, the largest you can find in those stores where they sell construction items, and you can make a small box for it with electricity behind to illuminate the back. And she, as you can see in the depth of her eyes, has a light that comes behind me and illuminates the patient's face. Where do I need to focus the details so that this photo turns out like it is here, right on the little green dot you see? That is, almost in the malar area of my patient. is where I need to focus to get the detail I want from this type of images. If you do it in the front, it might come out a little blurry at the edges. So this is the specific tip. So you can do it in the best way. We are going to have the front smile photograph. This front smile image also requires a bit of our wit with the patient to make them laugh. The patient is tense. Nobody likes to be told, smile, I'm going to take a picture. So, you had to joke a little to relax the patient and get a real smile photo. Remember that what I want to evaluate in this is how the patient's real smile is. 2. Among other things, determine the cementation heights. For example, for my speed protocol, which I need to be suitable for the patient. So, this is a tip I also give you with this. We have this type of photograph that I sometimes like to take. It's called the smile of the precise moment. So, you will notice, here I see it perhaps a bit shy. I can keep shooting this photo. Notice that it's not a photo with an authentic smile. Here we see that there is a smile, perhaps a bit better. And when we have gained the patient's trust, we will have a smile that even involves the eyes. This is the ideal photograph to evaluate the type of smile my patient has. That's why it's called the smile of the precise moment. And when I take it, I have to be prepared to take a series of photos and choose the best one. 3/4. This photograph is essential for us. We have to ensure that we can analyze the 180 social degrees of the patient. Why do I call it that? Not necessarily always see the patient from the front. When he is in society, someone might be looking at him from here or might have someone who can be seeing him from here, who can be seeing his teeth. So I need that information to ensure that what I am building in that smile looks perfect in my 180 social degrees. So this is the 3/4 shot. Look at where it should be aimed or where I should focus and where I need to place my eye to get this type of photograph. So I position my camera here, set up the settings, and go directly to this malar area to get the photograph. The extraoral profile series. In the same way, I have to obtain all the detailed information of the profile without shadows that slightly distort the image and also distort the information I need to see. Not only the type of nose, the nasolabial angle, the labial projection, the Mentonian angle, and everything I have to see in the neck area, which is so relevant for our aesthetic part. Very well. We then continue with the other set of photographs we need to take for our patients, which are the intraoral ones. Here, you will see some examples of photography that can even become artistic photography. Look at the level of detail observed here in these photographs. Imagine this for marketing your practice, for content marketing of what you do day to day, or to show the patient a before and after with this type of photographs. This really is a very powerful sales tool. So document your cases. That is my advice in every certification I can share with you. So here I am. How do we position the patient to take our intraoral photographs? Here I am only using the flash, the ring flash, which is the one I use. The ring flash with the attachment I mentioned earlier, which is this diffuser. I set my settings. I point and look here at the tip I have to give you. Well, to get even more detail there, this photograph perhaps shows a mistake. And it's that, in the back part, look, it's not very clear. So the depth, probably the F or the aperture of the diaphragm, was in a different position than 22 or 29, as I was saying. Maybe I could be at 16, and it affects the visibility over there, and look at the detail I'm getting. So I set my F22, remember, or 29, but here it's key that my eye Focus on the canine. When I focus on the canine in detail, I will obtain information not only from the anterior sector, but also from the posterior sector. When I take my lateral photograph with a mirror, as I like to do, then look at where you should place your eye, this time in the premolar area, the area of the first premolar. That's where you need to focus to get detail from the anterior and posterior sectors perfectly complete. Here, we have another image of the left quadrant in occlusion. Look at the level of detail we can see. Notice that you can see all the capillary vessels, the enamel, the external structure of the enamel, the irregularities it has, things I have to consider even to perform my cementation precisely. So, where am I going to focus? Look where the little dot is. Premolar area, adjust my settings. There are other settings, but the most important ones are those three I mentioned. Rather, if you want to learn a bit more, if you're interested, we can do another webinar where we go a bit more into the details of photography. Maybe a bit more practical so we can understand it better. But this can be a very good introduction, I know it can. So, let's focus on the premolar area. We take our photograph and this is the level of detail. Notice that there is something very key, and it is that when you are going to take intraoral shots, dry the patient's mucosa very well beforehand, or ask the patient to swallow saliva so that the saliva does not appear in this area. So, sometimes if we leave saliva, small bubbles can appear, or small shadows, or reflections of light or flash in that saliva that cause detail to be lost and obviously become a distracting element when trying to evaluate what I want to evaluate in a photo. Here is the position I take to photograph the upper jaw. So, the patient helps us by retracting their lips. We teach them very well how to do it. Remember that the patient's lips need to be very well lubricated for this. We rely on our assistant to position the mirror. And if we see the need, she still has half the triple syringe ready to apply air, if necessary. She always has it in her hand. If I see something fogging up, she immediately takes care of it. The time to do a complete intraoral photographic follow-up in my consultation is approximately 4 minutes. So we can say, no, if I take photographs, an exaggerated amount of consultation time will be wasted. It really doesn't happen. When we standardize the capture, and when your team is perfectly trained to help you with the captures, you will do it very, very, very quickly. Now let's look at the occlusal photograph. When we take it here, I have to, when focusing, divide into quadrants. I want my complete midline to appear. I cannot have the camera tilted to one side or the other, or inclined or not, but rather aim for the shot to be as perpendicular as possible to the intersection at that point you see there between the midline and the premolar area. And look where I have to focus, where I have to place my eye and focus to have a complete view of my upper or lower arch. There, I'm giving you the little tip, the trick to have very high-quality photographs. Here we are, as I get a little closer to the patient with my 60 macro. As you can see, the one I'm using here, we are going to take the lower occlusal photograph here. So, this is what we have in the lower occlusal photograph. In the same way, my midline. I try to focus on that point you're seeing there, very lateral. And in this area, I will go almost to the first molar. That is my focus point. That's where I focus. Set everything, my camera, so that everything is clear and the image is visible, and I take my shot. The ideal is to be able to see how the photo turned out by enlarging it a bit. And if I see the need to retake it, I do. But look at all the information I need. I want all the present teeth to appear, and the structures that I am needing to evaluate, and my patient. Well, I hope that up to this point we are doing very well and are comfortable. After we have obviously taken the photographs, what we have to do is edit them. So there are programs that we use to be able to edit the photographs. What I also advise you is to have a memory card with a lot of capacity so that you can take photos without restriction. They put them on their computer. I have a paid version of Lightroom, an Adobe program that allows us to do photo editing very quickly, very intuitively. We don't really need to have knowledge or be overwhelmed by this number of variables here. It's very simple to do. Increase the exposure a little. If it turned out dark, or improve the contrast, or improve shadows, lighting. Well, as we say here in Colombia, we can tinker. That is, we can work a bit with these variables on our own and learn by ourselves what we are doing. If we see the need to do it online, there are very good courses on editing in Lightroom. If not, one of the ideas I have is to also create some tutorial videos that you can access later, where I can teach you how to do photo editing using these tools from one orthodontist to another orthodontist. So you won't complicate your life with this. I've already done the curve and I can tell you how it can be managed. So my suggested software could be Lightroom, and it is very intuitive and very easy to handle. In this way, we will have the possibility to present a clinical case, not only to a community of colleagues who want to gather to share information, but also at conferences and even to the patients themselves. I generally have many clinical cases already detailed in a correct PowerPoint template or Keynote if you use Mac, and I show new patients' cases very similar to theirs, and they identify with this. Therefore, the decision to start the treatment, to begin their treatment with me, I can leave almost 50% up to what they visually see as a probable result in themselves. So, the presentation of the clinical case involves this, a simple template that, as I tell you, you can make in PowerPoint or manage in Keynote if you want. This is the way I personally like to present it. You will see that there are some other doctors who flip the occlusal photograph lower and put it upside down. Well, here I prefer to do it this way. So we have a lateral view, a frontal occlusal, the other lateral, a superior occlusal view, and an inferior occlusal. This allows me, as I was saying, to take into account many variables that I might need to correct in the next appointment and plan for them in advance. In other words, dental photography also makes me efficient. Here we are looking at a clinical case. The progress I am making, I tell the patient, look, here we have taken approximately 5 appointments. This means that our timing is good. We are controlling the time variable which is relevant for the patient. And when the patient even sees this type of progress, they are motivated to cooperate much more, for example, with the use of elastics or with the use of elements that require their cooperation. When the patient says, but I am having significant changes in my mouth, sometimes we have patients who say, look, honestly, I don't see any change. There's always a patient who comes up with this. And we say, no, come here, I'll show you the photograph from a month ago and the one from now, see that you have changed. Then the patient says, okay, yes, you're right. I see another reality right now. And they relax a bit with the anxiety caused by the treatment times. Here, we see this set of photographs to evaluate my 180 degrees here. What can I do? I can include in this type of photos 2 profile photos that will also be very useful. So here, I can evaluate how their facial structures are, how their lips are positioned, which interests me a lot. In this smile photograph, I can have all the information. For example, look at the smile arc. Then I can evaluate here if there is definitely consonance of the incisal edges and cusps of the upper teeth with respect to the upper edge of my lower lip, as you see here. In Sarah's case, our patient, can we say the smile arc is fine? Or do I need to raise these brackets a bit more to achieve this? Well, look at the information. I can see how she looks from this side, how she looks from the other side, and have valuable information about the progress. I can show them and educate my students if I am a teacher about what I am achieving with my patient. Final progress. I can make comparisons. Look at the comparison I can have here of a smile in progress versus what I am already achieving. I can ask the patient for their feedback. Do you like what you see so far? Or do you want me to make some kind of different adjustment? Do you want to see yourself in a certain way? So it's very important to also consider what the patients tell us. And when we manage to have them see themselves and give us their opinion, then we will have had a successful treatment together. Thus, the final results, and these final results, speak for themselves. These clinical results show us a total success of our case. These are the photographs. Perhaps a bit more artistic. I like to take them myself. I have them here in the same setup that I have in my office, which is very simple. I tell them to come very organized, very nice that day, and we do a final photo set to be able to share all these details with them. Look at the degree of mini aesthetics, macro aesthetics, their lip aesthetics, everything the patients are asking me for. So, it's a gift we give them. What the patients do is post this photograph on their own social media, and we get free advertising for ourselves here, like in the case of our patient Sarah. Well, I hope we have had a session that has somehow contributed something to your clinical practice. Remember that OSI is providing these kinds of spaces so that we can get closer to those audiences who are behind the screens or those who are in the same way in our certifications and congresses, and that we can, from orthodontist to orthodontist, share how we do things in our day-to-day. If you want more information or have any questions, you can use my email, which you have there. You can follow me on my social media on Instagram. You will find me as a Dr.Calderon Orthodontics. And well, I hope to see you very soon or at some certification or in one of these spaces for more of you. So if you have any questions, I am here ready to help you. Remember, my name is Jorge Calderon. We will be here to keep growing together.